All right, welcome to the Explainer. Now, we've all had a cut or a scrape, right? You clean it up, slap a bandage on it, and pretty much forget about it. But what happens when a wound just won't heal? Well, it turns into this incredibly complex medical puzzle. And today, we're going to dive into the science of solving that very puzzle. A systematic approach that can literally be the difference between healing and a chronic, long-term problem.
Now, I know what you're thinking. A wound and a skyscraper? What's the connection? It's a bit of a strange comparison, for sure. But think about it. Just like a massive skyscraper absolutely needs a detailed, flawless plan to stand tall and not, well, fall over, a complex wound needs a precise, well-documented blueprint to heal correctly. If you don't have one, you're really just guessing. And in medicine, guessing can lead to disaster.
Okay, Section 1. A wound's complex story. We're going to start with why just looking at a wound isn't nearly enough. Which brings us to Section 2, the blueprint for healing. To crack this puzzle, the whole care team needs to be on the same page, speaking the same language. And that blueprint, it actually has a name, the ICW Documentation Form. ICW stands for a German group, the Initiative Chronischer Wunden, or Chronic Wounds Initiative. But what you really need to know is this. Think of this form as the universal translator for wound care. It's what forces everyone to collect the same data in the same way, every single time. So nothing, and I mean nothing, gets missed.
And this blueprint, it's not just more paperwork. No way. It's a seriously strategic tool. For example, we're tracking the wound's size and depth to see if it's actually getting better. We're looking at the skin around the wound to check its health, and even the amount of fluid coming out of it, that's called exudate, is a huge signal for infection risk. See, every single data point helps guide the team to choose the right therapy.
So having all this data is great. It's a huge step forward. But how can we be absolutely sure we're seeing the full picture? I mean, numbers and descriptions can be a little subjective, right? How do we make sure that what one person writes down is seen the exact same way by everyone else on the team?
That brings us to Section 3, Seeing is Believing. The answer? You bring the data to life with objective, visual evidence.
You know, it's a simple idea, but it's incredibly powerful. Data tells part of the story, but the photos, they tell the rest. The data gives us the hard facts and figures, but a photograph? That adds the context, the undeniable reality of what's going on. And together, that's when you get the whole story.
But here's the thing. You can't just whip out your phone and snap a quick picture. For a photo to be useful medical data, it has to be done right. There are rules. Rule 1. The framing and distance have to be uniform, exactly the same every single time. Rule 2. The lighting has to be great and the image has to be tack sharp, no blurriness. And Rule 3, this is crucial. You have to use a scale marker in the shot so everyone can accurately judge the size. Following these rules, make sure the photos are reliable data, not just random pictures.
And this is where you really see the power of a picture. I mean, think about it. Without photos, you get these vague, subjective descriptions like, oh, it looks a little better. What does that even mean? With photos, you have cold, hard, objective evidence. You can literally put them side by side and see the wound shrinking over weeks. There's just no room for misinterpretation.
Okay, so now we've got our data blueprint and we've got our visual evidence from the photos. So, what now? Well, now we use them to actively chart the healing journey. This is the part where we evaluate the progress and decide if we need to make any course corrections along the way.
And this evaluation isn't just random. It happens on a strict schedule. It all kicks off with that initial assessment. That's our baseline, our starting point. Then, like clockwork, every 1 to 2 weeks, the team does a systematic review of all the data and all the photos. By week 4, you can really start to assess the healing trajectory. Are we on the right track? Are we hitting our goals?
Which leads to the million-dollar question, right? What happens if the journey goes off course? What if the data shows the wound isn't healing, or, even worse, it's getting bigger? Does the whole system just fall apart?
No, absolutely not. In fact, the system is built for this exact scenario. If progress stalls, a really clear protocol kicks right in. First, you adjust the current therapy. If that doesn't do the trick, you escalate to further diagnostics. You can bring in experts from other disciplines for a fresh set of eyes. And all the while, You're constantly reevaluating patient-specific factors. It's a proactive, intelligent response system, not a panic button.
All right, let's zoom out for a second. This incredibly detailed approach, it's not just about helping one patient in one clinic. It's really about establishing a gold standard of care that can be used everywhere, guaranteeing quality across the entire healthcare system.
Because this isn't just about one patient's chart. It's about building a system where every single patient, no matter where they are, receives the same high-quality, evidence-based care. When you create these standards, often through certifications from organizations like the ICW, you build a system that's just more reliable. And the ripple effects, the benefits of this kind of quality assurance are huge. Of course, it leads to improved patient care and way fewer complications. But then, that in turn actually lowers healthcare costs for everyone. And you know what? It leads to higher satisfaction across the board. Patients are happier because they heal faster, and doctors and nurses are more satisfied because they know they're delivering the absolute best care possible.
So let's bring it all home. Section 6. Why this system matters. Because when you get right down to it, behind every data point, every photo, and every quality report, there's a person. A person just waiting to heal and get back to their life.
You know, there's a core principle from the ICW standard that just puts it perfectly. It says, professional documentation and systematic quality assurance are integral to optimizing wound care. Integral. Not optional, not nice to have. It's the absolute foundation of modern, effective treatment.
So when you boil it all down, it comes to this: one system, with one goal, successful healing. By combining a solid blueprint of data, clear visual evidence, and constant evaluation, we transform wound care. We stop hoping and guessing, and we start engineering success. And it kind of leaves you with a final thought, doesn't it? What other areas of medicine could be totally transformed by a blueprint this clear and this simple? For more explainers that break down complex topics just like this one, please subscribe to the Al Ashkar channel.